Okay, so these are the three component elements of the test: the swab collector or sponge on a stick, the sample processing tube with chemical reagent, and the test cassette, which is in the foil ripped pouch. Now we're just going to talk a little bit here about the sample collection method for getting your saliva onto this swab. Now when this comes out of the packet, as we'll open it now to show you, first thing you notice is this swab is really quite rigid and firm. It's solid. It's dried, desiccated, and to moisten that, obviously it goes into the donor's mouth and you ask them to start feeding saliva around it. As they do that, the sponge will soften, and at that stage what you want to do is ask them to work this sponge around the oral cavity extensively to pick up any drug residues. By doing that, you will significantly increase the pickup rates of drug, particularly cannabis drug residues, which are left in and around the oral cavity after smoking cannabis. So they work this in front of the teeth, behind the teeth, top and bottom, around the inside of the cheek and gums, roof of the mouth, and really around the base of the teeth. And you work it quite thoroughly and then ask them to feed saliva onto the swab until they feel it going completely soft and squishy. And you should not be able to, with your tongue, feel any firm or rigid elements in that swab at all. There is a central core or prong of plastic which holds it in place, so it won't come loose if they push this with their tongue gently, okay? But the idea is then to put it under the tongue and ask them to completely saturate it with saliva for about 2 to 3 minutes sampling. And what we're going to do in part 3 video is just show you, once that's completed, the difference in the swab, processing of the saliva, and just the agitation that's required to mix the reagent into the saliva.